Welcome to The Explainer. Today, we're digging into the PALOMA 3 study. We're going to focus on some results that could really change how you administer Amivantamab and honestly, just make your patients' lives a whole lot better.
All right, let's just jump right in with a question that hits close to home for all of us in oncology. I'm talking about time toxicity. It's a massive burden on our patients, and let's be real, it's a huge strain on our clinics and resources too. You know, IV therapies are amazing. They're the bedrock of what we do. But they come at a cost, right? Hours and hours in the chair for our patients, and a real logistical headache for the clinic. This is exactly why there's such a huge push to develop subcutaneous versions. The goal is to completely overhaul the treatment experience.
And that brings us right to PALOMA 3. This is a phase 3 study that was set up to answer a really simple but incredibly important question. Can we give Amivantamab subcutaneously and make the patient experience way better without giving up any of the clinical effectiveness we count on?
So the study took 418 patients with EGFR-mutated non-small cell lung cancer. These are patients who've already progressed on osimertinib and chemo. They were randomized to get either the subcutaneous or the IV version. And the results? Well, they were crystal clear. The study hit its primary efficacy endpoints, proving the subcutaneous form is non-inferior. But get this, the safety profile was actually better, with a 5-fold drop in infusion-related reactions. Now that we've established that crucial baseline, let's get into where the subcutaneous route just blows the other one out of the water.
And here is where you see the night and day difference in practice. On one side, you have a manual injection that's over and done with in about 5 minutes. On the other, you have an infusion that can drag on for up to 5 hours. This single massive difference in time is the domino that sets everything else in motion when we talk about patient satisfaction and clinic workflow.
Okay, so we know the efficacy is the same, and the safety is even a little better. So now we can ask, what is arguably the most important question? What did the patients actually think? How did it feel? The study didn't just look at the numbers, it looked at the human side of the equation. And the answer was just, wow. A whopping 77% of patients who got the subcutaneous injection said they preferred it over their past experiences with IV treatments. I mean, that's not just a slight preference, that's a landslide. This chart really drives it home, doesn't it? You can see it plain as day. The data from just the first cycle shows this huge majority favoring the subcutaneous option. Only a tiny fraction, just 8%, said they'd rather stick with their old IV routine. And this wasn't just a vague feeling of preference. It had a direct, measurable impact on their lives. More than twice as many patients in the SC arm felt not at all bothered by the time it took. Same thing for feeling not at all restricted. And check out this last one. Over a third of them felt like they actually got time back in their lives. Compare that to just 7% in the IV group. That is a huge deal. Now, this massive win for the patient experience is really just one side of the coin. The study also measured the ripple effect this had on the clinic itself, and the data here is just as compelling, especially if you're trying to manage a busy practice. So, let's be clear. The difference in chair time isn't small. It's not incremental, it's massive. We're talking a median of 23 minutes for the subcutaneous shot versus 6.5 hours for the IV infusion. For your patient, that's the difference between popping in for a quick appointment and writing off their entire day to be at the clinic. And this wasn't just a first-day thing. The time savings held up. By the third cycle, chair time was still almost 6 times lower. And look at how that efficiency cascades down. Active time for healthcare professionals nearly cut in half. The time the treatment room was occupied dropped by over 60%. These are the kinds of gains that add up with every single patient, freeing up chairs and taking a huge load off your staff. So let's tie this all together. What does this data actually mean for you in your clinic tomorrow? Let's boil it down to the key, actionable takeaways from PALOMA 3. Really, it comes down to these 3 things. 1, it's just a much better experience for patients. 2, it's a game changer for clinic efficiency and resource management. And 3, and this is the most important part, it does all this without any hit to efficacy and actually gives you a better safety profile. It's a win-win-win. The study's authors really don't pull any punches. Their conclusion is pretty direct. Based on all this evidence, the subcutaneous form is set to become a preferred option, a new standard of care that improves things on all fronts, for the patient and for their outcomes. And that really leaves us with the final question, doesn't it? When you have something that offers such clear, measurable benefits to both patients and clinics, with zero trade-off in how well it works, are we looking at the new standard for how we give this therapy? The data from PALOMA 3 makes a pretty powerful argument that the answer is yes.